it is a real disappointment. I listened to the minister yesterday when she announced the news, and I almost felt a little bit sorry for her because as she struggled to explain the inexplicable. So she said that the program didn't meet the government's goals, but when asked several times about what goals, she said it was hard to measure goals. I find that a little bit interesting because of course, there are some goals that they did measure that are in their reports to Health Canada that were very positive. And in fact, if you read, and I have been keeping track of their ongoing reports to Health Canada on the pilot, they've all indications have been very positive. So it is very disappointing.
What are those benchmarks that you're seeing? What Osborne said yesterday was, yes, that it's hard to pinpoint what the cause and effect would be in terms of seeing any improvement. But she said they did not see an increase in self-referrals to care or an increase in use of services. What are the benchmarks that you believe indicate that there was success in this?
Yeah, so I find that statement a little interesting because if I look at the report to Health Canada, in fact, what they said was that core service utilization indicators, that's the language they use, are stable and increasing. And that included visits to overdose prevention sites, supervised consumption sites. We know that arrests for possession and seizures of drugs across the province were down. And not only were they down, they were becoming more equitable. So prior to the decriminalization pilot, in its application to government for the exemption to Section 56 of the Controlled Drugs and Substances Act, the province said one of the challenges was inequitable policing for drug offenses. Some towns police far heavier than others. And there was a lot of discretion on the part of police. And that was a real concern. And we already know that there are real challenges with inequitable enforcement across a number of offenses across the country. So that, and in addition, deaths decreased substantially. And I acknowledge what the minister said, and I don't falter for that it is hard to attribute any one thing to some of the indicators, but the death rate in our province has decreased significantly. In fact, we're right back to 2019 rates, which are far lower than they have been in the last 7 years. So that's a positive indicator. All of these things to me suggested that nothing got worse in terms of the goals they were trying to achieve, which was to positively impact the health of people who use drugs, steer them towards health services, and encourage people to be forthcoming about their substance use and their need for help and support.